To get started. Welcome. Welcome to all. Today, I first want to recognize the courageous nurses who are presenting their stories about medical cannabis today. I am so humbled to be among those who are willing to broaden their knowledge of this plant medicine by sharing their own personal journeys and brave acts. As Heather noted at the beginning, we are blessed to come together to speak and to learn and to inspire each other. Thank you for being here. I'm going to start with a quote by Chimamanda Ngozi Adichie, who's a Nigerian author and speaker. You may have seen her on TED Talks. And she says, stories have been used to dispossess and malign, but stories can also be used to empower and to humanize. Stories can break the dignity of a people, but stories can also repair that broken dignity. And today, I will tell some stories. There'll be stories of first meetings and stories of a villain and stories about healthcare, stories about my mother. And in the end, all the stories we tell will be sewn together and added to the other stories presented today by all the nurses to create a quilt of comforting information that we can climb under together and feel safe. Because though we are safe in this room, there's a monster under the bed. Medical cannabis is a story that is often told quietly and carefully, secretly, and sometimes even fearfully. But here today is a place that we can speak about this topic openly in community with our peers and family and friends, and we are unrestricted and speaking from our hearts. But to tell our stories takes courage. My name is Marilyn Pierce, and today I will bring a flashlight to the room to shine a light under the bed, and I will also be using stories as I speak about the stigma of medical cannabis. So I'm going to start with a story, of course, and this is a story of the first time that I even met medical cannabis. It was a day in 2018. I was in a position to do a professional interview with a physician who was advocating for medical cannabis. And he was going to the state capitol to request that the list of eligible diagnoses be lengthened to advocate for his patients. See, I already had my historical feelings about cannabis in place. I came at this topic from my information from my early 20s and late teens. I called it pot or weed, and I smoked it to catch a buzz. And I quit all of that when I became a professional nurse and passed boards. And I considered myself an open-minded, liberally thinking, non-judgmental clinician. And I was fine with what others did in their free time. I had my own ideas about what his story was. You see, I saw him before the interview outside preparing to be happy, but as the interview proceeded and I began to hear his story, I was shocked as I was faced with my own prejudice and discrimination about this plant. This physician was a palliative care physician. He took care of chronic pain patients, and it was during an athletic activity that he broke his neck. And 2 years and two surgeries and many, many opioids later, he had actually become one of his own patients. And he was depressed and he almost lost his practice. And he admitted to feeling suicidal thoughts until he found medical cannabis. And he spoke of pain relief and how he was able to wean off opioids and return to his life and his passion of caring for his patients. And he described a system, an endocannabinoid system. This is the first time I had ever heard a physician speaking like this in my own clinical language about the effects of a medicine and this new system. And he spoke of hope, something that he had never been able to bring to his patients before. And this was why he was fighting for laws to protect and allow this option to be available and accessible. And after listening to his story, I reached a pivotal moment in my life. It was a fork in the road. My historical understanding of cannabis that I had learned in my teens and early 20s was not aligned with this medical use. I had my idea of what cannabis was for and why people used it. I knew it was an illegal drug, and though it was basically harmless, it was of no use for anything but catching a buzz. And I was above all of that. You see, I was a clinician in the healthcare system, and I had research and security and knowledge and prestige to back me up. And if this was something that I needed to know about, I would have gotten an in service or a webinar. I would have been invited to join a class. But that day was my stumbling start to my relationship with medical cannabis. My professional beliefs about cannabis and what I thought and believed about those who used it came to a crashing halt. I had to face myself, for I had judged this man. I had imposed my prejudice on him. I had been regally clothed with the stories I held true in my royal clinical expertise and splendor. But now suddenly, this emperor had no clothes. So let's talk about what stigma is. I want to define it. And I'm going to use, there's lots of definitions, but today I'm going to use the one by Lincoln Phelan that was created in 2001. And it is the co occurrence of its components, which are labeling, stereotyping, separation, status loss, and discrimination. When I look at myself and the way that I judge this physician that I interviewed, it's hard to admit, but I would say that most of these were present in my mind. And I was under the umbrella of stigma in my judgment of this man. So, where does stigma even come from? Stigma against cannabis. That's another story. Stories today. So, once upon a time, there was a little boy. He was about 12 years old, and he lived in the cornfield area of Pennsylvania in the farms. And it was 1904. He had gone to a neighbor's house and he heard this horrendous noise. It was the screaming, howling, screeching sound coming from the second floor of the house. And when he got there, the neighbor's husband came running down the stairs and he said, "Boy, take my cart and my horses and go to town, go to the pharmacy and get this package and bring it back right away. Go, go." And the howling and the screaming and the urgency just frightened the boy. And he got on the cart and he ran. He went as fast as he could to the pharmacy, got the package, brought it back. And the man came down, got the package, brought it up. And within minutes, that howling and screaming ceased. It was the wife of the man. And although her screaming and howling ceased, the scream never left this little boy's head. His name was Harry Anslinger. Anslinger went on to work in the military. And he was involved in World War I. He did some prestigious work. After the war, he took a job as an alcohol prohibition agent, and he worked his way up very quickly through the department. In 1930, he was placed at the head of the Federal Bureau of Narcotics, which is now known as the DEA. And that was a really quick advancement. It might have had to do with the fact that he married the niece of the Secretary of the Treasury, who was Andrew Mellon at the time. But anyway, also one of the richest men in the world. But Harry got this position in 1930, and this was the position over the department that was in charge of the alcohol prohibition enforcement thugs. So he had a large department, well financed, and a bunch of thugs. But in 1930, right after he took the position, alcohol prohibition ended. And so, for many reasons, to keep his job and to support what he had acquired, Harry Anslinger started a war on drugs. Anslinger was a racist. He targeted people of color. He hated Black people, especially jazz musicians, and he also hated Mexican immigrants. And he used all the qualities that we find in stigma to create a stigma against cannabis: labeling, stereotyping, separation, status loss, and discrimination. For you see, cannabis at the time was not illegal in the early 1930s. It was listed in the US Pharmacopoeia, Doctors were prescribing it. People could get it over the counter. It had been in use in the medical system since the 1800s. It was used for all kinds of things that we use it for now, such as migraines and epilepsy, sleep, anxiety, calming nerves. Everyone called it cannabis, but Harry renamed cannabis. He called it what the Mexican immigrants were calling it, marijuana. Harry launched this strategic and very successful negative propaganda campaign against marijuana right under the noses of the American people who were using cannabis, as well as the American Medical Association and the physicians who were prescribing it. And he suppressed opposition and hid facts by using newspapers, movies, radio, magazine, posters. There was no TV yet. And his efforts worked. For in 1937, the Congress of the United States passed the Marijuana Tax Act. Now, this didn't make it illegal. It just prohibitively taxed it to the point where it was so expensive, you had to have all these special stamps that if you didn't have all of that in place and you didn't pay all that money, then the thugs from the Federal Bureau of Narcotics could bust you. So people began to step away from it, and it was not used anymore. And that's what the propaganda caused. But the worst part of his propaganda was not the horrible stigma that he created. He made it feel not only illegal, but evil. This medicine that had been used in so many ways for so long was now evil. And this all happened back in the 1930s. But we still have a really strong stigma against marijuana or cannabis. So why? Why is it persisting? Well, it wasn't until about the 1960s that people began to be more overt about their use of cannabis. And during the 1960s, there was a lot going on. There was a Vietnam War. There was a lot of strife, and a lot of people were being very tormented by the loss of life and this war that was going on that they didn't understand. It was a decade of open use of marijuana, and hippies who were actually being overt about it. It was a decade of freedom of cause and a decade of war. It was also a decade, and this really doesn't have much to do with stigma, but I can't help but mention Raphael Mechoulam. Back in the 1960s is when he, with his curious scientific mind, isolated tetrahydrocannabinol, the actual molecule that is intoxicating in cannabis. And we are so grateful for his curious scientific nature. For many years, he has provided the opportunity for us to learn more and more about this beautiful plant. And we lost Dr. Mechoulam this year, and we will always consider him the father of cannabis, thankfully. But in the 1960s, people were dying in this useless war, and the hippies were targeted for speaking out about it. And if I, as a clinician now, a cannabis clinician, look back at the 1960s, what I recognize is that everyone was trying to cope with their anxiety and their torment, and they were medicating themselves with cannabis. They were overtly using cannabis to calm themselves during this very difficult part of a time of life, to sleep, to be able to just live with what was going on. And if we were to see this now, we would probably label it PTSD. And we all know that cannabis supports PTSD. But the stigma perpetuated, and in 1970, President Nixon declared a new and updated war on drugs. The first thing he did was he created the Controlled Substance Act and signed it into law. And he took cannabis and dumped it into the Schedule I status that made it absolutely officially illegal. Interestingly, though, he did this with a stipulation. He created a commission to study marijuana and make recommendations to the government about how to manage it. The commission was called the National Commission on Marijuana and Drug Abuse, And what it did was it was run by a former governor. His name was Raymond Schaefer. He was a former governor of Pennsylvania, and he was given $1 million to investigate and learn about cannabis and give recommendations to the government about it. It was referred to as the Schaefer Report, and it came out 2 years later in 1972. Interestingly, on the first page in the first paragraph, he said, or the report recommended that nonprofit use and distribution of marijuana would be tolerated, and that public possession of 1 ounce or less would not be punishable. These were their recommendations. And in the second paragraph, there was a quote from an article in the New England Journal of Medicine that said, in the long run, marijuana legalization appears to hold the greatest promise for effective and intelligent control of marijuana use. And then this document is still used today to support decriminalization and legalization, though at the time it was tossed aside and did not even come near Nixon's ideas of how to proceed. And it wasn't just Nixon. As time went on in our federal government, Reagan supported federal laws to perpetuate stigma. The Reagan administration gave the states money. This was a state-run program. 38 states had a domestic cannabis eradication suppression program. And what that was the states going after domestic growers, people in the United States who were growing cannabis, and they kept track of them. I saw the spreadsheet, who they were and who they arrested and how many plants they had and how many plants they destroyed. And the more they kept track of that, the more that program was given money by the federal government. And they trained people and they went out and found this. And the other thing that Reagan did that I thought was really interesting and I did not know was, with the flick of a pen in September of 1986, he made it mandatory for all federal employees to be drug tested. Now, I'm old enough to remember when you didn't have to pee in a cup to get a job, but it was Reagan that created that for the federal government. And of course, that's going to spread out to anyone that gets federal government money. And now it's just common knowledge that we pee in a cup to go get a job. So interestingly, that was not true until late 1986. And our wonderful, well-loved President Clinton, I did not inhale. During his reign, during his presidency, 4.1 million people were arrested on cannabis charges. That is more people than ever before in history. And thank you, President Clinton. But the perpetuation of stigma continued beyond that. And we've all been around and alive since the year 2000. And the labeling, the stereotyping, the separation, the status loss, and the discrimination continues because supported by the fact that it's still federally illegal. Although for the past 30 years, we all know that states have been legalizing and decriminalizing cannabis, yet the federal law remains intact. But we can't just blame the feds, because there are other countries in the world that have legalized cannabis. They have, doctors are prescribing it to patients in other countries. And just because it's legalized doesn't mean the stigma goes away. There's stigma present even in the midst of lawful use. So some of our countries that are lawful, such as Israel, did some stigma studies. One of them in Israel, it was a small qualitative interview with just an N of 15 of chronic patients who were using medical cannabis. And the results showed that medical cannabis is not yet normalized there, and that the people who were using medical cannabis had to manage the stigma and determine who they spoke to and separate themselves from the recreational users so that they could just be medical cannabis users because of how strong the stigma was. Another study in Israel was with 240 physicians who responded to a questionnaire. And it showed that the intentions of physicians to recommend medical cannabis to cancer patients was different than the intentions to recommend to chronic pain patients. It was determined that there were non-medical influences prevalent and that there was more of a stigma for the chronic pain patients than to give medical cannabis to cancer patients. So there's a division that isn't just about law and practice, but something about this monster under the bed stigma still existed. In the UK, they've been prescribing medical cannabis since 2018, and a study was done with over 2,300 patients receiving medical cannabis prescriptions about their perceived stigma. And the participants felt a very high prevalence of stigma from society, from government, from the justice system, and also from healthcare professionals. Only 38% of the participants thought that healthcare was approving or even somewhat approving of their medical cannabis prescription, and they had fear of what the healthcare professionals thought of them. Another legal country is Canada. The University of British Columbia studied stigma around medical cannabis and found that patients were labeled irresponsible and unreliable by society, including healthcare workers. The stigma of medical cannabis actually had a negative impact on the relationship between patients and healthcare workers, and it was a barrier to receiving care that was needed. So let's look at stigma in our not yet legalized federally United States. The United States healthcare systems did some studies around stigma, and cancer patients revealed that they were more comfortable talking to their family and friends about using cannabis than they were about disclosing to their healthcare professionals, which does compromise care. Also, California voted for medical cannabis and in 1996, and a study showed that the medical cannabis users continue to decide who they're going to reveal to because of the fear of stigma and the repercussions of those who will think things of them. Let's talk about another story. Here's a story about my mom. This is my mother, and she lived with me the last 4 years of her life. And toward the end of her life, and she had end stage Parkinson's disease. So I went to the doctor with my mother very frequently, but towards the end of her life is when I learned about medical cannabis. And so I started to ask for doctors about it. I asked one neurologist about it, and he said, obviously he either didn't know or didn't want to talk about it, and the subject was closed. Okay. She went to another neurologist later on, and this was a university-based healthcare system physician. And so I said, my mom with her end-stage Parkinson's disease, do you think that medical cannabis might help to improve her quality of life or some of her symptoms? And he said to me, it's hogwash. Okay. I didn't talk to him about that anymore, but later on we had an appointment with his nurse practitioner, and I asked her, what about medical cannabis? And she said, I don't know. Honest. And finally, I spoke to her primary care physician, who incidentally had MS. And she was walking that day with a cane. She was stiff and in pain. And I asked her, for you and for my mother, what about medical cannabis? And she was really uncomfortable. And finally, she said, yes, I've looked into it, and walked out the door. She didn't want to talk about it. So how does stigma show up in our lives, in our personal lives? We all need to want to talk about medical cannabis, but we have to determine who it is that we can talk to about it. Because the elephant's in the room. In order to speak about medical cannabis, you have to determine who it's safe to speak with. And my brother lives in a legal medical state, and he's on medical cannabis for pain. But I don't think he's told any other of the siblings about it, or if he has, he's been very specific about who he tells. The stigma, or the elephant, also shows up in our social lives or our religious lives. There's certain networks or areas that we just can't talk about it. One of the networks that it may be difficult to talk to about it is in our religious networks, especially in the South. There is such in the Black churches in the South, it is very negative to speak about cannabis, and that is probably because of the fear of arrest. Um, I live in Georgia. We have some of the most abundant number of prisons, and we have to keep those prisons full to manage the economy. And so cannabis has been and still is used, especially targeting Black people in the keeping of the prison system full. And so cannabis has a negative um, stigma still, especially in the South. And what about cannabis at work, in our professional lives? Is there a conversation going on? Or is it the elephant in the room? Can we talk about cannabis where we work? Maybe. If not, then how do we get over, under, around, and beyond this elephant, this stigma elephant in the room? I'm going to propose two methods of getting over the stigma of cannabis for addressing this elephant in the room. The first one that I'm going to propose is called medicalization. So Newhart and Dolphin, who are two wonderful sociologists who are actually married to each other, wrote this book, The Medicalization of Marijuana. And the definition of medicalization is when something previously not treated as a medical problem transforms or phases into something that is treated within the medical domain or paradigm. So an example of this might be something like ADHD. ADHD used to be, oh, those parents just don't know how to bring up their kids. There's something wrong with them. They get to school, they don't know how to act. But now ADHD has been transformed and moved forward. Now it is actually a diagnosis, and there are pharmacological treatments so those children can go to school and sit and drool. So that would be one example. There are others, maybe fibromyalgia and chronic fatigue syndrome, complementary and alternative medicine that has been now becoming more medicalized. There's 5 phases to medicalization, and I want to go over them really briefly just because we can see where cannabis comes into these 5 phases, medical cannabis. So the 5 phases are definition, prospection, moral entrepreneurism, legitimacy consolidation, and institutionalization. So first of all is definition. So definition is when the behavior is recognized and defined as morally defiant or deviant, and it is considered. There may even be laws against it. It may even be restricted. So ADHD was morally deviant, and cannabis has laws and restrictions against it. That's definition. The next step of medicalization is prospection. Prospection is when the first signs of that medical categorization of this deviant behavior are potentially being considered. It may include some new terminology. For an example, instead of chronic fatigue syndrome, it's now called myalgic encephalomyelitis chronic fatigue syndrome, MECFS. Or, for instance, the cannabis use disorder diagnosis that is new since 2013 to DSM-5. It even has an ICD code so they can get paid for it. So prospection is the second phase. The third phase is moral entrepreneurship. Moral entrepreneurship is expanding the medical categorization. And this is done by moral entrepreneurs who we are all moral entrepreneurs. They are people who are not possibly directly benefiting or affecting, but they are proponents of what is going forward. They seek to influence and to create an adoption of existing rules to be made more strictly enforced, or for new rules to be created. An example of a moral entrepreneur would be Mothers Against Drunk Driving, MAD. They ask simply just follow the rules and strictly enforce them. Pro-life movements, LGBTQIA2S, anti-pornography, cannabis nurses, or American Cannabis Nurses Association. We either want the rules changed or we want them to promote them to be more strictly enforced. So that's moral entrepreneurship. Very important, because the next phase is what we lead into, which is legitimacy consolidation. And this is when the proponents of medicalization goes, proponent medicalization goes beyond just the entrepreneurs. It maybe go into legislative rulings and laws, and possibly some policy and procedures will be changed. And also it determines who's going to manage things, who's going to take care of this if we do make it legal. For instance, cannabis has been made legal in Minnesota recently, and it has been determined that the Board of Pharmacy is going to manage it. So they are in the legitimacy consolidation phase of medicalization. And finally, phase 5 is institutionalization. And this is when the medical definition becomes the dominant paradigm. It's public fact, it's incorporated into medical institutions, it's taught in higher learning, and opposing views become suppressed. So now that people who believe that ADHD is bad parenting, they're like, no, you're wrong. That's a medical diagnosis now. We can take care of that with drugs. So that's the institutionalization. That's what we are aiming for medicalization for marijuana, for cannabis. But unfortunately, it takes more than laws to create change of heart, and to create change of mind. And for instance, there are laws against hate crimes, but that doesn't mean it doesn't still happen. Ryan's law exists in California, but that doesn't mean it's not a hassle for a patient to get their medical cannabis at the bedside in a hospital. Barbara Ochester is a medical cannabis nurse advocate and activist, and she brings up the subject of how if you go and take a pee in a cup test and you come up positive for opioids, all you have to do is show them your Percocet prescription and you're clear and free. But if you come up positive for cannabis and you hold up I have a medical cannabis card, you're still not going to get hired. So we can't depend on federal laws or laws themselves or medicalization to simply change it. Maybe it has to do with money. Maybe if we had enough money. No, all the money in the world and the stigma monster is still going to show up. Elon Musk, one of the richest men in the world, billions of dollars, rockets out into space, and he spent 15 seconds on a Joe Rogan podcast puffing on a cannabis rolled product, and it was an illegal state. He did nothing illegal, but as a result, his stock went down 9%. He was chastised by large companies, put down by the general public. NASA even investigated Tesla, saying that they were breaking company policy. So it takes a little bit more than money and laws. Let's tell another story. This is my personal stigma story. So I remember when I was taking care of my mother, who, again, I had end stage Parkinson's disease. And I had asked her doctors for help and they said no, but I was still considering it. I mean, she was at the end of her life and I was considering, should I give her medical cannabis? And I began to consider it. And what came to mind, well, what if a home health nurse finds out, or my mom, who had a little bit of dementia, said something or spoke of something about it? Or what if they found out and they stopped my mother's resources and they didn't come anymore, she couldn't get her medicine? Or what if I lost my job? Or what if they took my license away? What if I got arrested? What if I couldn't take care of my mother? What if this was my personal stigma story? This prevented me from taking care of my mother in the way that I would want to. The labeling, the stereotyping, the separation, status loss, discrimination. I was a victim of personal stigma. I was afraid of the monster under the bed. What if? So the second way that I believe we can break the stigma barrier is with our stories. We need to break open the stigma with stories. We need to do more than just educate our family, friends, and patients. We need to tell them about our own personal journeys and stories. Because you see, nurses We've always been peers with our patients. We understand that people are suffering and we relate to them as equals. We are, as Margaret Newman said, on a level we are in within their expanded consciousness. We as nurses relate as equals because we understand their suffering. We connect. It's how we reach them when their loved one is dying and we cry with them and tell them our story and they know that we understand. It's how when we visit them in their homes for home health or wound care or hospice care that we get to know their whole family and all of their names and we listen to their stories and become a part of that part of their life. When we work in a hospital, I worked on an end stage renal disease floor, and those patients are in the hospital at the end of their life more than they're out, and you spend time bringing a special recipe in that you knew they would love, or you pick some flowers from your garden and bring it to them or the family. It's when we cry with them because they're missing their grandson's baseball game and we are at work missing our own son's soccer game. And when we hold the iPad up or the iPhone up so that they connect with their family when they're in the ICU and they can't be near them. It's when we show up for funerals. Some of us do that because we knew them and we worked with their families. It's when they have PTSD and we understand because some of us worked in a healthcare system, in a hospital during a pandemic. We understood and understand PTSD. Alcoholics Anonymous and Narcotics Anonymous is a peer-driven um, uh, source of care for addiction. Why does it work? It's because we listen to our peers. We listen to people who understand what we're going through. We follow people who are walking the path that we want to follow. Knowledge and understanding, that's really important. Education is important. Laws, money, all important, but it doesn't change minds. But stories told with empathy can create miracles. We have the way to break through stigma, through the barrier. We have the bright flashlight to see that monster under the bed. Because the more we speak of our own pain in the journey and the path we took to get where we are, the more people will listen and their hearts and their minds will change. It takes more than just education, law, and policies to change. We must connect. It's about being part of a collective consciousness. Cannabis is spirit medicine. It heals all. It works with the endocannabinoid system to naturally heal and connect. We can bring light to the darkness under the bed with our stories. We can heal the wounds from stigma with our stories. We can change laws and we can change minds with our stories. And we can be the leaders of change that we already are. And we can overcome stigma with our stories, our personal stories, one person at a time. A belief is a story that's told over and over again until it's believed to be true. Stigma is a belief. That's how it came to be. It was made up of stories, wrong, untrue stories. So we can change those stories and we can change stigma and we can tell our own stories, our true medical cannabis stories. So I urge you to use the quilt that we make together, made of the collective consciousness of our own journeys and our own stories, so that we can all feel safe and warm on our journey. Be sure to tell yourself and anyone else you know as many stories as it takes to keep the quilt growing, and feel confident that within each of us is the stories and the light that of truth that will always protect us from the monster under the bed. That's my story, and I'm sticking to it. Thank you all.